Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE, and talking today with Cissy, and she will be talking about the clinical trials that she has gone through. Cissy, can you introduce yourself?
Absolutely. My name is Christine Cissy White. I'm honored to be a GRACE Fellow. And I just wanted to share a little bit about my experience. I am a mother and a writer. And in 2019, I was diagnosed with stage 3B ovarian cancer. And for ovarian cancer, stage 3 and 4 are considered advanced. There's about a 15% chance for a cure if you have been diagnosed with ovarian cancer stage 3. But for the majority of those of us who get this diagnosis, it's a recurrent diagnosis. So we will have multiple rounds of recurrence, and then we'll need a lot of treatment. So I knew that early on in my treatment and started looking into clinical trials right away because of that, because my grandmother was diagnosed with the same type of cancer in the late 1980s, and I knew her. I helped take care of her with my aunt, and her prognosis, she had several recurrences, but she only lived for a little less than 2 years. The stats are a little bit longer. People tend to live for 3 to 5 years with an advanced cancer diagnosis. But even that's not guaranteed. Up to 20% of people diagnosed with advanced ovarian cancer die in the first year. So it's still a pretty scary diagnosis to get. So that was part of the reason for me that when I started doing the research, I wanted to look at clinical trials as well as the standard of care. But I knew the standard of care had some limits. So right from the start, I was curious about what else is new and potentially being explored that might benefit me. So I've been in treatment for 3 years, and I've done 3 trials as well as, 3 other lines of treatment. So yeah. It's been a big part of my treatment.